Okay. Hi, my name is Shika. I'm going to ask you some questions about healthcare, and or accessible care to your community. There are no right or wrong answers. Please answer each question in detail if possible. Your honest answer will help advocate for improved health of your community members. Okay, first question is what do you think the top issues of your community, like the top health
Okay,
issues?
so the top main issues on the healthcare communities first for me is the access to healthcare. Many people have difficulty finding primary care providers, specialists like a dentist or the mental health professionals, especially in rural areas. Second, there is a chronic diseases, conditions such as diabetes, high blood pressure, heart disease, obesity. The third one, it's probably the mental health,
Mm-hmm.
like depression, anxiety, substance use disorder, and suicide. Um, Fourth one, I think, is the health insurance and the cost of care.
Mm-hmm.
Even insured patient may delay care because of the high deductibles, co-pays, or medication costs. Lastly, I think the preventive care. Many people miss recommended screening, vaccination, and the routine checkups.
Ah, okay. Do you think there is a gap or issue to access these?
Yes, so some gaps in regards to community healthcares include like shortage of healthcare providers,
Mhm.
not enough primary care providers, some specialists, what I said, also the lack of health insurance or underinsurance,
Mhm.
because people may avoid seeking care because of they cannot afford the visits, medication, or the procedure.
Right.
Third, I think is the transportation's barriers, because limited public transportation or long travel distance make it difficult to attend appointments, especially in the rural communities. And lastly, I think the limited clinic hours. Many clinics are only open during standard business hours,
Mhm.
make it difficult for people who work full time to receive care.
Right. Okay. In your experience, what are some of the barriers um that need to be? What did I say? Sorry. Some of the barriers
Yeah,
that's already been
to
tried to
improve.
resolve these problems. Do you think these situations work or?
Yeah, to improve this access to community healthcare, there's a several practical solutions like increase primary care access,
Mm-hmm.
like expand community clinics, urgent cares, or the mobile clinics too.
Mm-hmm.
On expand the mental health services too. So integrated mental health into primary care like telepsychiatry or increase the number of counselors or support groups. And also the reduce the financial barriers because help residents enroll in insurance program, offer sliding scale fees, provide medication assistance, something like that.
Oh, great. Okay, so what is your understanding of assuring interprofessional collaboration related to the health promotion?
So my understanding in interprofessional collaboration is essential in community healthcare because it brings together healthcare professionals from different disciplines to address the needs of patients in the community like nurses, physicians, pharmacists, social workers, mental health providers, public health professionals, and many so on. Effective communication, mutual respect, shared decision making, coordinated care.
Hmm.
It will help improve access to healthcare.
Do you have any examples of issues related to health, um, or healthcare, or access to healthcare
Yes, I
issues?
do have some several the like a real world example of issues like long wait times for primary care appointments. So
Mm.
patients may wait weeks or months to see a primary care provider, delaying their diagnosis and treatment.
Mm.
And then also limited access to mental health services. There may be too few counselor or psychiatrists, causing long wait lists.
Mm.
And transportation barriers too.
Ah,
Older adults, people with disabilities, or those without a car may miss the appointment because of they cannot get get to a clinic. And of course, the high healthcare cost.
mm,
Patient may skip doctor visit,
mm,
medication, or recommended tests because they cannot afford them.
mm-hmm. Well, thank you, sir.
You're welcome, man.